Hello, everybody. Welcome to today's lecture, and we continue covering the integumentary system. And in this video, we will talk about diseases and homeostatic imbalances of the integumentary system. And we're going to start with cancer. Yeah, not a very good beginning, but you know what? We need to know at least basic about skin cancer. Actually, we will cover here 3 types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Now, when you see this word carcinoma, that means cancer originate in epithelial tissue. That's what carcinoma means. Now, what are basal cells and what are squamous cells? So we need to go back to the structure of epidermis. All right, so as the epidermis is made of different strata, and the most superficial stratum is stratum basal. So if cancer originate in this stratum, we call it a basal cell carcinoma. If cancer originate in the stratum spinosum, and those cells are flat or squamous, then we call it squamous cell carcinoma. If cancer originate in melanocytes, and you can see melanocytes shown here in kind of greenish color, it's also found in stratum basal. But if cancer originate in melanocytes, we call it melanoma, right? So now let's go back. So basal cell carcinoma affects mitotically active stem cells found in stratum basale. It's most common in US when we're talking about skin cancer. It's the most common type of skin cancer and a less aggressive. Most common, but thankfully like slow progressive and less aggressive. Usually affects head, neck, arm, back, pretty much where you have more exposure to the sun. So it's caused by many things, including UV radiation. It can be arsenic, some other type of radiation. Starts in stratum basale or basal. And this is a picture of the cancer, how it might look. And one feature that can help you to kind of identify it, or at least be more concerned if you see it in your patient, you will see actually see these blood vessels, lots of blood vessels within this tumor. So it's not very small, it's not very big. It might be pretty small tumor, right? It might look like some wound that just does not heal, or it healed for a while and then, it's continue to develop, but you will see blood vessels. Next, squamous cell carcinoma affects keratinocyte and start in the stratum spinosum. It's 2/3 of cancers, and this one can metastasize. So it's more aggressive and more dangerous than basal cell carcinoma. And here you definitely see like a sore that does not heal. It might be, it have some dry flakes around it. Right. But of course you need to be professional to begin with, and then you need to do way more testing before you can even, assume it's some kind of cancerous cells. But it always better be safe than sorry. So if you see anything that looks suspicious, doesn't look good on the patient, it's better to double check, right? Because the earlier we can catch the cancer, the earlier we can diagnose it, the better prognosis is for that person. Now, melanoma. Melanoma is highly metastatic cancer, really pretty dangerous. Develops, it not always develops from mole. It might develop from mole. Sometimes it does not, but it does definitely start with melanocytes. It's the most fatal and progresses very quickly. Now we can, and medical professionals, they use A, B, C, D, E rule to diagnose melanoma. So it might look like a mole, but if it's asymmetrical, it has uneven borders, it has color, and color usually means you have two types of color. Like let's say you have a darker color and then you have lighter color. There is no symmetry, so it's not this nice and round mole. The borders might be elevated. It's also diameter is larger than, so if you have your pen and you have eraser on a pen, so it's larger than eraser on a pen, and it's evolving, so that means it's changes. Well, diameter, I would say it's 5 centimeters, or more than 5 centimeters, then it might be an alarming sign, right? So again, A, B, C, D, E. A for asymmetry, B for borders, and it's might be elevated borders, as I just said, 2 or 3 different colors, more than 5 millimeters. Oh, I'm sorry, did I say centimeters? Oh my goodness, 5 millimeters, 5 millimeters. And evolving, that means it's changing over time. And additionally, more serious is if it's elevated, if it's firm, if it's growing. That's evolving actually includes growing as well. Right, but you know, the patient has some things that look suspicious, then biopsy will be taken, and we will look at the histology slide and see how this tissue is changing to understand if it's cancerous or just a mole that just doesn't look normal. Right, so again, we have, in this chapter, we have 3 types of cancer: basal cell carcinoma, most common, less dangerous. Squamous cell carcinoma can metastasize, and highly metastatic, most fatal, dangerous skin cancer, melanoma, that develops from melanocytes, affects melanocytes, and we can use ABCD rule to diagnose it, at least the first diagnosis, and then biopsy for to confirm or hopefully disprove our first diagnosis, right? Another disorder of the skin, eczema. It's allergic reaction, and it's look like dry skin, and your body produces antibodies against dust or mites, or it can be just even some type of food. Even today they say eczema does not really relate it to food allergy, but again, sometimes it's possible as well. Eczema might be common in small kids, in the infants, and then it might completely go away, or it can develop into more serious condition. Okay. Acne, everybody familiar with this disorder. Acne develops in areas rich in sebaceous glands, and sebaceous glands are oil glands, common with onset of puberty. And actually, it's a bacterial infection of your skin. Staphylococcus, one of them. So if you see here, that's a skin and a hair follicle, right? And this gland over here, this is oil or sebaceous gland. So what can happen, we can have accumulation of keratin, and it will pretty much block the follicle, right? So here we have a blockage of the pore, and then bacteria will proliferate. It will proliferate because it has lots of oil here that is a good food for bacteria. That now this oil should be deposited on the surface of the skin and lubricate it, prevent from water from evaporation. All right, but if you have lots of now keratin and oil, and it's pretty much like closed structure, then you have proliferation of bacteria. So right here, you can see this all bacteria growing here, and it start causing inflammation and acne. Okay. Burns. Now, what is a burn? It's heat, electrical radiation, the other type of radiation, certain chemicals. You can even, for example, if you use vinegar, if vinegar get on your skin, it can also cause chemical burn. And of course, it can be burned from heat. But it's a damage of the tissue, the nature of protein, and cell death. Interesting that immediate threat from the burn is actually dehydration. Because if you remember, one of the very important function of your skin is to be a barrier, and it prevents water from leaving your body, right? So you do not lose too much fluids from your body, and when you do, it's called dehydration. You lose water, you lose electrolytes, and electrolytes will be like sodium, potassium, those cations, anions, and this can lead to renal shutdown and circulatory shock that we would call hypovolemic shock. Hypovolemic means related to low blood volume because you're losing so much fluids, right? Now physicians use rules of 9 to estimate the volume of fluids that is lost from burn. So you can, the patient will need fluid resuscitation. So you need to add more fluids to your patient, but you need to know how much need to be added, right? And there is a special formula that allow physician to calculate how much fluid need to be administered the first 8 hours, the next 16 hours. We will not go into detail with this formula, but you can see to use this formula, you need body surface area that was damaged by the burn, right? Because you need to take 4 milliliters, you need to multiply by this body surface area that was burned and multiply by weight of a patient in kilograms. So rule of 9 is used to determine this variable or parameter, BSA, body surface area. Now, how exactly is that done? So your body, we call it a rule of 9 because your body is divided into parts, and each part is either 9% of your surface or half of 9, so 4.5. So look, if you look at the trunk, right? So here's your trunk, anterior surface of your trunk is 9% of your body surface. Posterior part of the trunk is also 9%. Anterior part of abdomen is 9%. Posterior part, back, that's 9%. Now, anterior part of right leg is 9%. Anterior part of left leg is 9%, and the same with posterior part. So those are all 9, 9, 9, 9, 9, right? So that's a rule of 9. Now arms are smaller than legs, so they're 4.5%. So total anterior and posterior surface of one arm give you 9%, and anterior and posterior surface of another arm, like left arm, give you 9% as well. Anterior part of head and neck and posterior part of head and neck will give you 9% as well. And there is 1% left that is perineum, and that's area over here where your external genitalia is. So the total 100% of the body surface area, right? So, and of course it's approximate. So for example, this patient has like this part only damaged, right? So it's only left part of the anterior trunk, right? Left part of the anterior trunk. So if you know that the whole trunk is 9%, that it's gonna be about 4.5, right? So it doesn't mean that patient need to damage this entire area for this to be calculated like 9%. So you can really estimate based on this number 9. That makes sense? I hope it does. Now, we also have different degrees of burns: first degree, second degree, third degree. And in many resources, you will only see first, second, and a third. But I like to add the fourth degree because it does make sense for me. So the first degree affects only epidermis. I want to remind you, epidermis is the most superficial part of your skin, and it heals on their own. It doesn't require medical attention, really. Second degree affects epidermis and portion of dermis, and this is where blisters occur. Now, the first and the second degree burns are, painful because epidermis, it's not vascular. That's why you do not form blisters, because you need fluids to form blisters, right? Epidermis is pretty, I would say dry part of your skin, but it's not vascular, but it's innervated. So you do have nerve endings in epidermis, so you will feel pain. Now for second degree, you will feel pain and you will have blisters. So if somebody has a blister, you can, easily diagnose with the second degree at least. Now, third degree, we have epidermis and entire dermis. That's pretty bad. It destroys tissue, it affects nerve, and it's require medical attention. And because it affects nerves, right? If your nerve's dead, you cannot feel pain. So third degree burn is usually not painful, right? That's horrible. Really bad burn, but the patient might not even feel that much pain. I mean, that's good, I guess, if you don't feel pain. Right, yeah, that's what happened. Third degree might be not that painful because nerve endings are destroyed. And the fourth degree affects underlying muscles and bone. Full thickness burns cannot be repaired by body and require medical attention, and it's of course emergency. Okay. So how critical burns are? Critical if more than 25% of the body has second degree burns, more than 10% of the body has third degree burn. And of course, it also depends on where exactly burn is, and it's more dangerous when we have face, hands, feet, when they bear third degree burns. Right, so here we can see again our different, classification of burns. We have first degree, so we just have redness over here and just epidermis is damaged. Here we have damage that reaches dermis a little bit, right? And we have blister appears. Third degree, the injury extends to all layers of the skin. So you can see entire dermis damaged, and fourth degree when we get to the muscles and tendons and bone, right? That's very, very deep damage. Okay, so now, for example, if you have a patient and there is a hair follicle, right, and you can just pretty much just remove the hair, the whole hair follicle, then that's probably a third degree burn. Okay, next we have scars and keloids. Now, scars are collagen-rich tissue. It's actually scar tissue. Fibroblasts are the cells that generate the scar. So when your dermis repairs, those fibroblasts start depositing collagen, and usually it deposits it into irregular pattern. And when it does it in a regular pattern, then that's what we call scar tissue. Sorry, I had to stop recording for a minute. My mom called me, and I always answer when my mom calls because she's an older person, and you never know what happens, right? So now, where do we stop? Injuries. So we are in homeostatic imbalances and diseases of skin. So scars and keloids. So we talk about that fibroblasts that generate scar tissue whenever you repair your dermis. All right, so that's what forms scar. Keloids is overproduction of scar tissue when collagen formation does not stop. And then you see this scar on the surface of epidermis. So let me go back for a second and just remind you, it's not in this chapter. I'm sorry. It's our previous chapter. And we talked about wound healing. Now, epidermis is healed by regeneration. So we have, when you have a normal process, when you do not overproduce scar tissue, when you cut yourself, your epidermis will heal by regeneration. So you have the same type of tissue, epithelial with same function, and underneath we will have a scar, right? But when this scar tissue grows on the surface of the body, that's when these keloids are formed. Okay. Next one, bedsores or ulcers. They are caused by excessive pressure, common in elderly patients, can become infected and even fatal. And if you're thinking about nursing career and nursing degree, this is something you need to watch for. Now, how bedsores are formed. So for example, you have a patient and patient is not moving much, right? Now you can see, the back of the head, shoulders, elbow, right? So some parts of the body, pretty much so it shows over here. So you have a bone, right? So you have a bone in your arm, you have a bone in your head, and in your butt even, you do have, pretty big muscle here, gluteus maximus, but deep to this muscle, you have a bone. So you have a bone, so that's that's a bone. Then you have soft tissue, and the soft tissue would be your muscle and your adipose tissue and your skin, maybe, right? Oh, skin is right here, I'm sorry. So that would be your muscle. In your muscles, you will have blood vessels, then you have adipose tissue, also highly vascular, and then you have skin, right? So again, bone, soft tissue like muscle, that is vascular, hypodermis, and here's your skin, epidermis and dermis. Now these blood vessels are normally functioning, so they supply blood to your soft tissue, to your dermis, and through dermis to epidermis. Now, when you have a hard surface, and this hard surface can be a patient bed, right? So you have a hard surface, and you have those bones pushing against the hard surface. It's pinching of blood vessels. So you see, you pinch a blood vessel. If you pinch a blood vessels, you restrict blood supply to that particular area. Plus, you have a friction of the skin against hard surface. And because now the blood vessels are not supplying tissue with enough oxygen, and tissue are made of cells, those cells start dying. Cells die, that forms ulcer, and that can become infected, right? And infection can progress and cause very severe effects on a patient, right? So that's what bedsores are, or decubitus ulcers. Now, next we have stretch marks. Well, everybody familiar with stretch marks, especially, you know, if we gain weight and then lost weight, or if a female, we were pregnant, right? And then stretch our skin to the degree when we have tears in the skin, linear tears. So stretch mark develops due to excessive stretching of skin that causes linear tears in collagen and elastin. And then your damaged skin heals, but it heals by formation of scars. So again, let's show us skin. We have epidermis, we have dermis. In the dermis, you have collagen and elastic fibers. So if you stretch it to the point when you have this linear tear, you heal by forming a scar. And because this integrity of this part is not the same as it was before, you might have depression of the skin, and that's what we call stretch marks. So stretch marks are linear tears in collagen and elastin. Calluses and corns and warts. So what is the difference? Now, corn is a small, round, well-defined structure on the skin, like shown over here, usually on toes and non-weight-bearing areas of the feet, usually very painful when pressed, and it is caused by pressure and friction. Now, callus is larger and more diffused. So here's the callus. Usually on weight-bearing areas such as soles of the feet, calluses can also calluses can also be formed on elbows, hands, ankles due to high pressure to that area. So it's caused by pressure and friction. But it's, as I said, larger and more diffused compared to the corn that is smaller, round, and well-defined. And corn is usually not on weight-bearing area. And wart is round and diffused, and this caused by virus, right? Can be anywhere on the feet or other part of the body. Specific only for warts and not for corns or calluses is that warts have small capillaries growing through them, and that is why many times when they shaved, you can see pinpoint bleeding, right? Only warts will have those small capillaries that will give you a bleeding, but warts is, you know, very different from calluses and corns because it's caused by viruses. This caused by pressure and overproduction of keratin, right? Both of them. And the last slide in this lecture are developmental aspect and specifically old age. Now with old age, epidermal replacement slows, skin becomes thin, dry, and itchy. Subcutaneous fat and elasticity decreases, leading to cold intolerance and wrinkles. Also increased risk of cancer due to decreasing number of melanocytes and dendritic cells. Right, so we get older, the skin become dry and thin. We have less fat, less elasticity, and because we have less fat, subcutaneous fat, less elasticity, then we have wrinkles, intolerance to cold. Now, why we have risk of cancer if we decrease the number of melanocytes? Because remember what melanocytes do, they produce melanin, and melanin protects your skin from UV radiation. Dendritic cells, those are cells of your immune system. We have less dendritic cells, we decrease our ability to fight infection of skin. Now over here, I really like this diagram because it shows you younger skin compared to older skin. And what we wanna look at this collagen fiber and elastin. So you see, it has like nice, very precise pattern over here. And you have this fibroblast that actually produce those fibers. So fibroblasts are cells that will synthesize collagen and elastin. And only fibroblast really knows how to put them in this perfect design, right? Now, with when we get older, not only we have decreased number of fibroblasts, they also not that active. And collagen and elastin breaks. As you see over here, they decrease elasticity and it forms a wrinkle in the older skin. Now, very often what they do, they use they say okay, let's use this lotion with lots of keratin on the surface. Now, this keratin that you use in a lotion, first of all, it has a very hard time to penetrate your skin because remember, your skin is a barrier. The whole function of your skin to prevent substances from entering your body. So the keratin on the surface, it will help you to moisture your skin. It's might be a good moisturizer, but it will not move inside, and definitely it's not going to arrange itself in this perfect pattern. What they hope to do to decrease wrinkles and keep our skin young, they want to activate those fibroblasts and kind of hey, fibroblast, well, continue doing your job correctly. Continue synthesizing collagen and elastin and keep this dermis nice and healthy, right? So if we can activate fibroblasts, and if you heard about different retinoids, right? That is derivatives of vitamin A. This vitamin A can activate fibroblasts, and hopefully fibroblasts will produce healthy collagen and elastin, and that will keep our skin younger for longer period of time, right? Okay. Anyway, that's it for this lecture. I want to remind you that the first video on the integumentary system covers function and structure of your skin and accessory organs of the integumentary system. And this is our second video when we briefly covered homeostatic imbalances. And as I said before, I paused this video, so I hope it still works okay. So you guys let me know if something is wrong with this recording. Thank you for watching, and I hope it was helpful.